Hello and welcome to Fertile Minds. My name is Dr. Violet Kieu and I'm a Fertility Specialist at Melbourne IVF. Today I want to talk about preconception genetic screening. I think genetics is the next frontier of reproduction. And the reason is we do know that we may be able to prevent some diseases from being passed on. Each of us has genes, one from our mum and one from our dad. So our genetic material is in pairs. And some conditions are called recessive conditions. That is, if you have one faulty copy of the gene, but you have a normal second one, you don't express that condition. You live as a healthy individual. However, if you have a recessive condition and have one from your mum and one from your dad which are faulty, you may be affected quite severely by some conditions. Now, the ones that are the most common and most commonly talked about are three, and they include cystic fibrosis, which is the most common recessive condition in Caucasian populations. The second one is spinal muscular atrophy, which is the most common serious neurological and muscular condition of childhood. And number three is Fragile X syndrome, which is the number one inherited cause of intellectual impairment. That's a little bit different genetically. That's actually an X-linked condition. So I have mentioned one from mum and one from dad, and genetically, as a female, you might have two X sex chromosomes, and as a male, you might have an X and a Y. Now, why I've gone through these in detail is that we can test for them now on a very simple genetic test before you get pregnant. And if the woman, the prospective mum, and the male, prospective father, if they both carry a recessive condition but they don't express it themselves, so they're just carriers, there's a 1 in 4 chance that they'll have an affected child. So that's a 1 in 4 chance of having a child of cystic fibrosis, or a 1 in 4 chance of having a child with spinal muscular atrophy if you're both carriers. Now, how do we know we're carriers if there's nothing wrong with us? And that's why this testing is a screening test for a population of otherwise well individuals. In terms of frequency, cystic fibrosis occurs in about 1 in 25 to 1 in 30 people, and spinal muscular atrophy about 1 in 50. So these are somewhat common conditions. To do a test, we do need some material, and that can be from a buccal swab or from some blood, and using computers and genetic sequencing, we can now look very rapidly at what was called the triple testing, but now we can do 250 or even up to 500 or so genes all at one time. It does take a few weeks as a turnaround time, but it really can be done. I've moved from 3 to hundreds of genes all at once, and that's where it's really important to know that to make a choice to do these tests, number one, it's not mandatory. You don't have to do the preconception genetic screening. But if you do, we will offer you counselling before and after, why you're doing it, what are the implications of some of the results, and what you might be able to do if you do test positive. Now, if you do test positive, the thing that we'll do is refer you to a genetic counsellor, and also, as required, a geneticist, so a medical doctor who specialises in genes. Thus, depending on your exact individual situation, they can give you precise information about your chance of having an affected child, what an affected child might look like, and how you might go around your fertility choices. In terms of the choices, if you are both affected, it may mean attempting to conceive naturally and spontaneously, and either deciding to do antenatal or prenatal testing while you're pregnant, for example through an amniocentesis or a needle through the abdomen, to sample the baby's DNA and to make decisions about care depending on that result. That's one way and has been sort of traditional way. What we can do as fertility specialists offer a way to potentially bypass having an affected child, and this is where we use a technology called PGT-M, pre-implantation genetic testing for monogenic diseases. That's actually where we use powerful IVF technology, so have an IVF stimulation cycle, collect eggs and fertilize with sperm. But once, say, our day 5 embryos, we gently take, an embryo has hundreds of cells, we gently take a few cells of the outside to test to see if that embryo contains those faulty genes. Because it does take a few weeks to run these tests, the embryo is frozen at day 5 to put back in a frozen embryo transfer cycle down the track. So once we've done an IVF stim, had our embryos, come back in a few weeks, then we'll have the ranking about those which are affected embryos and which are not, and then make a decision about of the unaffected ones when to transfer. It is a detailed process, and we are there every step of the way to explain why and what we're doing. Thank you so much for your time today. For me to discuss a little bit about genetic testing and pre-implantation genetic testing of embryos. If you would like to hear more from Fertile Minds, please like and subscribe. Thanks so much.